had stayed off the internet during this whole time, so I don't think I even understood what the difference between stage 1 lung cancer was and stage 4 sarcoma. So it was actually really hard because a lot of family was and friends were, again, I don't want to say excited. I'm so lucky to have the support of them, but they were relieved. I was not relieved. I was still hoping that I somehow didn't have cancer at 38 years old. My name is Ashley. I'm 38 years old, and I was diagnosed with stage 1 non-small cell lung cancer in September of 2024. My experience with cancer was fast and furious. I got the diagnosis and got the cancer out in a month, but I'm still processing the whole thing, honestly.
It turned my world upside down. I knew I had to understand my options, but navigating all of the information out there was overwhelming.
I actually didn't have any symptoms of lung cancer, but what I did have was a lump that I found on my chest wall that led me to a series of tests that ended up with the diagnosis of cancer. So in July of last year, I found this lump and it was on the side of my ribs. And I was really confused about it. So I made an appointment at my OBGYN and also my primary care doctor because it wasn't a part of my breast, but it was near my breast. Um, Both of those doctors weren't worried about the lump. They thought it was a lipoma. I got different recommendations as to like just going to see a dermatologist and getting the lump removed. But my OBGYN found a lump in my breast during that appointment that he wasn't concerned about, but said, let's just get you a mammogram and then they can do an ultrasound of the chest wall mass. Um, the mammogram was normal. The ultrasound of the chest wall mass was not. And so that led to them requesting or suggesting that I get a biopsy of that lump. They actually wanted to do the biopsy of that lump at the breast cancer center. And that's when I really pushed back because I didn't understand why I would get a lump that we knew wasn't breast tissue biopsied at a breast cancer center. But they said because of the proximity of the lump, they did biopsies like that all the time and that I had nothing to worry about. Forever, for whatever reason, I was really stuck on this. And so I pushed back again. I was literally on the table with the doctor getting ready to get the biopsy. And I said, I really do not understand why you're biopsying this. We know it's not breast. And she listened to me. She said she would go call a colleague who is a general radiologist. And that radiologist agreed with me that I should not be getting a biopsy there and that I should see a soft tissue oncologist because if it was cancer, it would be soft tissue. So they sent me to that oncologist. Then she wanted to order a CT of my chest before she would do the biopsy. And that's when they found a nodule in my lung. So for about 2 weeks, I thought I had metastatic sarcoma, and that nodule was a metastasis. But I surprised everyone when the biopsy of the chest wall mass came back benign, but the biopsy in my lung came back as cancer. It was hard at this point. I thought I was having metastatic disease. I thought I had a terminal cancer that didn't have a cure. And so a lot of other people in my life were, I don't want to say celebrating, but just so relieved. And those people had also done more research on sarcoma and understood what metastatic sarcoma meant as far as treatment options. I had stayed off the internet during this whole time, so I don't think I even understood what the difference between stage 1 lung cancer was and stage 4 sarcoma. So it was actually really hard because a lot of family was and friends were, again, I don't want to say excited. I'm so lucky to have the support of them, but they were relieved. I was not relieved. I was still hoping that I somehow didn't have cancer at 38 years old. And to be honest, the only thing I could think about was my two small children, like the whole time. It's just like the one thing, the one constant thing that I kept going back to is I have a 3 and 5-year-old. From July until September was the time where we were trying to figure out what I had. And was a roller coaster, right? Of like, it's nothing, now it's something crazy, now it's stage 1 lung cancer. And the treatment for that is a lobectomy because the size of my nodule, I lost the left lower lobe. And that was the only treatment that I needed as far as adjunct therapy. I did, however, seek out some second opinions, both with the surgeon and then also after surgery with an oncologist. Because I was stage 1, the standard of care was just to remove the lobe. But I wanted to understand if I had a gene mutation. I learned about that from the second opinion. One of the surgeons told me they would do that testing. So I went back to the original surgeon and asked if they would do that testing, and they said they would. But when they called me with my pathology post-lobectomy, they told me that they didn't do that. And I was a little frustrated because I really wanted to know why I got this cancer. So I sought out, they considered it a second opinion to speak to an oncologist. That oncologist agreed with me to do the gene testing. Most lung cancer patients, 86% of lung cancer patients get their diagnosis at advanced stage, so they would get this biomarker testing, but I'm one of 14%, so they didn't do it originally. I found out that I had a gene mutation, and then because of that, I did seek out a second opinion with an oncologist who specializes in the ROS1 gene mutation just to hear my options because there are targeted medications for those mutations, but they're not offered to patients with stage 1. So I did want to learn just more about it in case I ever needed something like that in the future. But my surgery was in October. I really don't go online a lot. So it's a balance. I'm a huge advocate for myself, but I do a lot of that through seeking out second opinions. I don't do the research myself. So with that being said, I talked to two surgeons, but I didn't do any research to really understand what the surgery was like because that's very difficult for me for like a mental health standpoint. So there were some good surprises about the surgery and some negatives. The pain was really hard. I woke up with a chest tube in, and that was incredibly painful. I was lucky I only had that chest tube for 1 day. So when they removed that chest tube, that helped alleviate the like immediate pain. But I would say the first week post-op was really difficult to sleep. I had multiple incisions from the lobe and also that benign mass I got removed during that surgery as well. So sleeping was incredibly difficult. One surprise from the surgery, I lost 30% of my lung capacity. And so I thought I was going to have trouble going upstairs or being short of breath. But I didn't. I mean, once I started reintroducing exercise into my life, like a month post-op, then I noticed the shortness of breath. But as far as like getting around and walking and doing just daily activities, I was doing pretty well. So it was really just pain management to begin with. The standard of care after a lobectomy for lung cancer is 6-month scans for the first 2 years and then annual. But because I sought a second opinion from a ROS1 expert, they actually recommend scans every 3 months for the first 2 years, then every 6 months for the two following, and then annually. And right now, that is like for the remainder of life. Whereas the standard of care is just up to 5 years. But their belief is that, and maybe you can go to like every 2 years. A lot of this is shared decision making. They recommend because 60 to 70% of reoccurrence happens in those first 2 years to get scans every 3 months. And they also want me to do tumor profiling. So either a blood test called Signatera, or there's certain markers that you can look at individually through blood test. So again, this is all second opinion, and I'm going with that more aggressive plan. Just being 38 and having two young children, I want to make sure I'm monitoring this really closely. The worst part of being diagnosed with cancer has been the mental health toll. Um, I work full time and have these two little boys that I'm taking care of, and um, it's very hard to process this diagnosis. And like I said in the beginning, it was kind of a roller coaster of first thinking it was terminal to now it's stage one to now it's out. Um, I, I'm a little over 6 months post surgery and I'm still processing it. I've had one scan. I have my second one scheduled for this month, and it's really overwhelming. They also found other things in the scans when they were looking for the cancer. So now I'm getting breast MRIs every 6 months as well. And I just have a lot of PTSD, a lot of fear, and I have a lot of resentment too. Like, honestly, I feel sorry for myself sometimes because I'm just like, consider myself a very healthy person. Like I make really healthy choices. I never smoked. I exercise. I eat pretty healthy. I drink in moderation, like socially. So I'm very resentful at times about getting this diagnosis. And it's just very fearful. I never thought I would get lung cancer. I knew nothing about lung cancer previous to getting the diagnosis. And I remember because I have family that's in healthcare, when they first found that nodule in my lung, that doctor, my family member, said, "Has anyone told you it could be lung cancer?" And I was like, what? Because to me, you got lung cancer if you smoked. Well, now I'm so immersed in the community as an advocate myself that I understand this growing trend of lung cancer in younger people, and a lot of it due to gene mutations. But I knew nothing about that. Like, it's incredible to me that I could not have come across this before, not seen an article. And now, because of what I do, I see growing trends in lots of cancers with young people. And it's really scary. It really makes me want to do something about it. Um, so I guess that specific diagnosis on top of just getting cancer at all was really surprising to me. I read somewhere that once you get a diagnosis of cancer, it divides your life into the before and the after. And it makes me very sad that I can't go back to the before. Um, I write a lot and journal a lot as a way to process what's happened, and I write about that. Like I wish that I could go back and just remember what did I worry about and what popped into my head. I've always been like an anxious person, so I'm sure I was worrying about something. I always kind of was. Um, but I would love to go back to when it wasn't cancer. You get like a cough and you're like fearful something's coming back. Or like I said, no, I have to get breast MRIs as well. Um, so I'm worried about that. It's just such a balance of trying to figure out how to move forward. And again, I feel very lucky that I got the stage one. Like they told me, one of the surgeons I met with told me it would have taken about 3 years, give or take, for me to present with symptoms, because lung cancer, the symptoms usually don't start until it's advanced stage. So it's hard to just feel that's lucky and still like how did I get this? Yeah, and there's a lot of survivor's guilt too because um when I do immerse myself in the community, I'm like, why did I get to find this early when all these wonderful young people didn't seek out a second opinion? I've I have a healthcare background, and so I understand there are guidelines and standards of care. I'm 38 years old. I don't want standard of care. Um, I I understand we need to have research-based guidelines to treat. However, I think it's important for you to talk to another physician and get another opinion, um, because you're an individual, right? And you have um, different tolerability towards risk, um, a different, you know, desire and knowledge base. And I think we should all talk to more than one provider. Everyone I've met with has been lovely, and I've learned something from them. Plus, like I've said, I just can't do this research on my own. I really trust the doctors. I just know that each provider will offer you different options. And so I really would encourage people to do that. And then the piece of advice I would give someone who, hasn't gone through something like this, but maybe, it has a family member or something, like just the more you can just be there as a support system and listen. I can't express enough how lucky I feel to have family, friends, neighbors, coworkers who've supported me through this journey. And the best support that I've gotten is people who just allow me to be sad, um, and don't try to find some sort of silver lining in this. I understand there are a lot of things that I have in my life to be grateful for. And also, I got cancer at 38, which sucks. And I don't have to find a silver lining in it. So that's what I would say.